just to give you a brief, so ADHD, what is ADHD, right? Attention deficit hyperactivity disorder, that's basically, or attention deficit disorder, one or the other, right? The hyperactivity component from many kids goes away once they come into the teenagers. Some of them with the boys, it may persist in them, but most of the boys or girls, it goes away by 12 years old, usually beyond that. The persistent problems are impulsivity and inattention, so that they will continue for lifelong. How they present is a very different thing. Okay? So typically when they do the studies around the age of 26, most of the brains mature. Once the brains mature, they are somewhat more manageable. So that's why suddenly after 18, if you look at the adult ADHD disorder, adult ADHD disorder, initially there is this concept that they after 18, don't treat them. We have patients in their 50s and 60s, high-functioning attorneys and stuff. So these are all basically now also take the medicine. But I describe ADHD as a disorder of two lenses. So if you're buying a camera, you're never going to buy just the zoom lens. You want the panoramic lens and the zoom lens. The panoramic lens is the most important lens for the camera. The reason is they use it here. For example, we talk this all the time. What is the attention does help us with? It helps with the organization. So for example, like I'm standing here. I'm seeing you all, right? I'm moving from eye to eye to eye and everything. And I'm observing a lot of the attention stuff, right? So bottom line is a lot of these ADD kids come into the doctor's office. There are 4 things hanging on the wall. Months goes, years goes, suddenly when they say, hey, I like that picture on the, it's been there for the last 5 years. So why did he pay attention then? Why did he pay for the last 4 years? Because the reason is a lot of these children, because they lack of attention, the attention details get lost. And they also are blamed for being lying all the time. I'll give you a very important example. Well, the reason I'm telling you is, before I go into the lecture, this is a couple of things you need to know about ADHD kids. One of the things is that the teacher announces in the class saying that tomorrow morning at 7 o'clock you have a bus to go, but the trip is at 8 o'clock. What does the child will go home and tell the parents? The bus is at 7 o'clock and we need to be there at 6 o'clock. And the mother gets up at 6 o'clock in the morning and drives the kid, and she comes to the school and the school is empty. And the mother gets mad at the kid, just like, you waking me up, you brought him here, there's nothing going on, what the heck is going on? And the kid swears that, I swear that I heard my teacher say 7 o'clock. I'm not lying, I'm not lying. And then the teacher comes at 7 o'clock, and the kid goes there and says that you said 7 o'clock, why we're not on the bus? And the teacher says that, well, I said 7 o'clock to come, not for the 7 o'clock for the bus. What's important here is that the fact is they hear what they want to hear. Okay? And they hear what they want to hear. It becomes a big problem for a lot of parents because the reason is they say, are you sure the bus is going at 7 o'clock in the morning? I swear by the God. But the bottom line is you'll never trust me. So I don't believe that. So you email the teacher basically say, if the heck it's 7 o'clock the bus is going, the teacher will say, no, it's 7 o'clock, no, it's 8 o'clock. But the kid who goes and says, teacher said 8 o'clock, no, it's 7 o'clock. We need to be there by 7. So that part is basically what you all call it, ODD, but that comes from the fact that the faulty information fed into the computer system basically imitating a faulty response. So once you fix the thing basically we call executive function, that's called flexibility, like a transition ability. So these are the kids who have a lot of trouble with changes, transitions, flexibility of the thoughts, shifting with the flow of things. All these things when they're happening, they have a very terrible time So they become so difficult to manage as a parent, so we get exhausted taking care of these children. Some of them, the minute they go out of the home, you'll be like ready to celebrate and have a glass of wine, do whatever you want to do until they walks into the door. But every parent is again guilty the minute he goes to school, saying, how can I think about my child this table? Okay, the minute he walks into the door, he'll be like, my God, when is he going to bed? So why am I saying this to you is it's the reality of people's life. But what you don't understand is that you're so used to it. So you won't take anything he says with the grain of salt. So periodically he tells you the truth, but you never believe it anymore. It becomes the story of the boy who cried for the boy. Alright? So this is the classic irony of the ADHD story. So you may ask me like, well, there are some people in this population here who are surviving the ADHD. How are they surviving? Because they have OCD. When you are comorbid with OCD, the OCD sometimes puts them in the overdrive to control their ADD, so they actually survive better. Okay? That's the food for the thought for a few minutes, so you can have a little fun with the practical scenario. So let's move to the next. So what is typically a consultation included? It's basically obtaining a thorough history, establishing the rapport with the family so that their trust can be earned, taking down the observations. This is called verbal observations and non-verbal observation. Always pay attention to the non-verbal cues that basically the family is giving it to you, and you are basically feeling towards the doctor because this is the time you're establishing the relationship. And then review the charts, testing for previous patients had, reviewing the health information provided. Because this is critically what involves a good psychiatric consultation. Okay, so what are the categories of symptoms? So the mood disorder symptoms. So we do basically check to see whether there is any depression, low-grade depression, any kind of feelings of down thoughts, ever experienced any depressive thoughts, ever had a manic episode. These are all the kinds of things you want to watch for. Then you look for the anxiety symptoms. These are basically like, you notice with a lot of kids. But remember one thing, anxiety is not bad. Anxiety is a good thing to have. It's a naturally evolved phenomenon in all of us. We did well because of our anxiety. The problem we have is that when the anxiety becomes excessive, then it's a problem. So it's like we call it, remember that? We have a curve called the bell curve. Up to that certain point, it goes up. And then after that, it starts going down. So if you have the optimal anxiety, you keep going up. But you have excessive anxiety, it goes down. So that's the key important thing about anxiety. ADHD, ODD, conduct, substance abuse, they all go together. So when you're checking for the extent of the ADHD, you decide what other symptoms you want to explore further. So somebody asked me a question like, so ADHD is comorbid with tics, OCD, anxiety, and executive functions with these kids. So you always basically, like if you see tics, you look for OCD, anxiety, ADHD. The same way, you look for ADHD, you look for all of these things. So it's because they have a common sharing gene sometimes. Poor impulse control and self-induced behaviors. So these are basically like, the things like gambling or impulsive buying, things like game addictions. All of these are the poor impulse control disorders because the reason is there tends to be, having problems in that area. Self-induced behavior. Sometimes, usually we see, like, you can say, like a skin picking as a part self-induced behavior. It's in autism-like people, but it's a poor impulse control disorder when it comes to the normal people. So, we see with a lot of excoriations with OCD and other things, so the key things is that you watch for those. OCD, what is it comorbid with? OCD can be a comorbid with the tics. Eating disorders also is a very common thing. We know this with the OCD because the reason is some of the kids basically get stuck. So it's a more societal thing, we call it. It's a lot more common in the US. I'm not sure how common that is in this country. But the point is it's more of expectation of a certain way you want to look and look good. So